Hi, I'm Dr. Daniel Knowles from Network Family Wellness Center, and I want to talk to you about a key aspect of spinal health today, which is a person's lower back, disc syndromes, and sciatic pressure. I want to talk to you about this because there's a lot of misconceptions. One of the key misconceptions has to do with thinking, patients as well as practitioners thinking that those concerns come from that part of their body. In other words, thinking that because the person's having pain or symptoms in that area that they need to be addressed by addressing that area. Really, that's like thinking that there's a light on the dashboard of a car, so the problem is going on with the dashboard. And the problem couldn't be further from the truth. A key concept is the concept of adverse mechanical cord tension. What I want you to think of is think of your body like a marionette puppet. And a puppet has strings. When you pull on a puppet's strings, it pulls its arms and its legs and its torso. Your body is the same way. When there's pulling on a person's spinal cord, your spinal cord and the nerves are your strings. And pulling on those strings will actually pull your torso. They'll pull your leg up short. They'll change the curvature of your lower back. They'll bring your shoulder up or tilt your head one way. And that type of spinal subluxation is when spinal subluxations or distortions or changes in alignment of the spine that alter nerve pressure and brain-body communication. Those types of subluxations affect what's called adverse mechanical cord tension. Adverse mechanical cord tension is a key concept in the dynamics of a person's spinal cord. It's basically that idea of a marionette puppet. There's pulling on the strings of your body, your nerves, and they're altering the position of their body. And what will happen is, if those are coming from a person's neck, their upper body, they will have 30 times the effect on the lower back that anything going on in the lower back will have. In other words, you can have pressure, change in discs, things, lesions in the lower back. It will have the 30th of the effect that changes in the alignment will have in your neck on the lower back. And what happens is, think of that marionette puppet idea. If the spinal cord's like a big string, you pull on that string, or kind of like an accordion with folds unfolding, or like a sweater. If you pull at the top, the strings at the top of the sweater, and the lower part of the sweater bunches up, that's what's going on. Pulling at the top of the spinal cord, and over time, that translates down the person's lower spine and compresses the discs of their lower back. And the person thinks they have a lower back problem, or they think that they bent over and picked up a piece of paper, or they had some recent traumatic thing that affected or threw out their back or threw out the discs. And nothing could be further from the truth. Over time, they've had multiple physical, chemical, emotional stresses that have increased the tension of spinal cord, kind of like turning the reel of a fishing line and cranking up their spinal cord and then compressing that disc. What has to happen is their system, their spinal system, that marionette puppet system, has to go from high tension to low tension. When it goes from high tension to low tension, literally as nerve communication is restored, as the tension on the spinal cord reduces, the disc space can actually increase, because the person's body no longer is having its life threatened and no longer needs to compress those discs mechanically. So what we want to see happen is a person's body get restored to its natural state, to have less tension on the spinal cord, less overfiring of nerves, better communication. And that better communication will help them have the quality of life and well-being that they deserve and were meant to have and is possible for their potential as a human being. But the key thing about that is not to focus on the area the person's having a pain or symptom, but to look at the whole spine as a system, get the tension off the spinal cord, rather than go for the quick fix that will be temporary and not sustainable. As practitioners, we all want people to have lasting changes. And a key for lasting change in a person's lower back, disc, or sciatic area is to get tension on the spinal cord and correct or reduce the spinal subluxations that are related to tension on the spinal cord. Thank you. Dr. Daniel Knowles, Network Family Wellness Center. Live well.